Thank you, Danielle. Right now, the state of Nebraska gaining a new status.
This is a hand up, not a handout.
With Nebraska becoming the first state to pursue Medicaid work requirements today, what exactly does that mean, and what are those requirements? Although there's been promise of success on the way, how will this impact really Nebraska in the long term? Channel 8's Emma Norwood joins us here in the studio to break it all down for us. Emma?
Hey, good evening, Rod. In my hand, I have one job application. Now imagine 100,000 of these. Governor Jim Pillen saying with the new Medicaid work requirements, that number can hopefully decrease, helping both those receiving benefits and the economy.
We, the incredible people in state of Nebraska, are the first state in the nation to begin implementing work requirements that are passed in the big, beautiful bill.
Governor Jim Pillen announcing new work requirements for those receiving Medicaid benefits on Wednesday. These changes mandate all able-bodied adults ages 19 to 64 must have a job, go to school, participate in an apprenticeship, work program, or volunteer, all in order to keep being eligible for medical coverage. This will go into effect on May 1st of 2026.
They're going to be improving their skill sets. They're going to have to spend at least 80 hours a month in order to maintain the Medicaid coverage, unless they qualify for an exemption.
Pillen saying around 70,000 Nebraskans will be getting notice by January 1st. Alongside the governor, Nebraska Department of Human and Health Services CEO Dr. Steve Coursey explaining how this will benefit the people of the Cornhusker State.
In short, work requirements foster purpose, stability, resilience, and long-term security for individuals, families, and communities.
We want to lift them up and help them understand and be a part of our economy, and lift them up and become better people.
But some organizations already raising the alarm following Wednesday's announcement. Nebraska Appleseed releasing a statement saying in part, quote, "This is a mistake." And the fact that the governor is already estimating that 30,000 people will lose their coverage proves that our state is not prepared or ready for the task ahead of them. But Dr. Mehmet Oz, administrator of the Centers for Medicare and Medicaid Services, believes this move is putting Nebraska at the forefront of their mission.
What you're doing so boldly with this action, being the first state in the country to use this legislation as an opportunity to create community engagement, is going to prevent generational poverty in Nebraska.
Now, some Medicaid beneficiaries are exempt from these work requirements, including disabled individuals, those in foster care, caregivers of disabled individuals, and many more, like you see here. In the studio, Emma Norwood, Channel 8 News.